Hi, Geraldine. Welcome back. So we have seen about stigma and the causes of mental illness and everything. So let us move on to the other, next part of the mental health problems. So during your sessions, as you said, people come and people mainly come neutrally. They do not know why they are suffering and everything, and do you try to help them? How do you lead your sessions? How do you take them to? Because when I go and sit to a counselor or psychotherapist, I have no idea what I will be saying.
Mhm.
So if I'm suffering from depression, it's really hard to bring things from me. So how do you initiate or how do you lead that one?
Well, I suppose we mentioned doing a full assessment with somebody.
Okay.
So during that assessment, you get a sense of what's been happening, what are the difficulties, how long has it been going on, how does it impact the person, what supports they've got in place, who did they go to, who's their go-to person, how has it impacted them, how severe is it, how compared to how they've been
Okay.
before and how they are now to get a clear picture. And from that, then, like what plans or what ideas do they have of where they want to go in therapy? What do they want to get from therapy? What do they want to achieve from it? And I suppose it's usually around, I suppose, targeting one area.
Okay.
So I suppose if somebody's depressed, it's well, they still might be working, but they might have given up maybe something they're interested, like meeting their friends or going to, maybe they enjoy sports or going to the gym. So what things do they want to get back, and what's stopping them from doing that?
Okay.
And sometimes it's just about like saying, well, you know what? If you're training for something, the expectation might be that I have to be in the humor to do it or I have to be informed to do it. And I often say to people, anybody who's training for a race or any, say, a marathon or even a 10K, they don't run in every evening and pull on their runners and go, yippee, I can't wait to go out there. They make excuses to go out. They say, oh, I'll do it tomorrow or, oh, I'll start next week. And it's about sometimes just putting on their runners and saying,
Yeah.
well, I'll walk out the door
Mhm.
and I'll walk down to the gate and I'll come back if I don't want to. But it's starting it.
Yeah.
And often people with depression they often say, well, I don't feel motivated. And one of the things people don't understand is that motivation doesn't come with feeling motivated. Motivated happens when I actually do something first. So
Okay.
action will actually help motivation. We don't wait till we feel like doing something. We need to take the action first. And a lot of my work is around educating people around different ideas or beliefs they have around how life works or how they think it should be, you know?
Okay. So I when I had a session, one-to-one session, I really found difficulty in this. Like engaging them. People say engaging.
Mm,
So sometimes, and moreover, interestingly, I just wanted to mention it as when I had to sit with the people suffering with mental illness, I really had to dedicate myself. I cannot think about anything. I cannot look into my mobile. I needed to be
mm,
a good active listener. I think
yeah,
active listening is a main part of to be a mental health nurse.
yeah.
So, what is your opinion on active listening?
I think it's vital. And I think that most of our patients know when we've lost, a little bit of concentration, or they can pick up when we're disinterested, or even I think maybe sometimes if we're confused or whether we're not getting something or understanding it, it might come across as disinterested. But I think as practitioners, we have to be big enough to say, I'm sorry, I got distracted there. Could you tell me that piece again? Or I don't understand that piece.
Yeah,
Can you explain a little bit more to me? So we're not saying active listening is a wonderful concept, but sometimes we fall short of it, even the best of people, for various reasons. Some
exactly.
days I'm great at listening, other days I'm slightly preoccupied. So it's about being very real with people and saying, I'm sorry, I lost you there. Go back to that piece and I just got distracted. So what we're doing is we're actually mirroring really good normal behavior, that we're not some perfect person. And I think one of the things people say is when they come to therapy or you're having your one-to-one as a nurse, that they think the nurse has all the answers and the nurse is, as I often say to patients, I don't have a blueprint for living. If I did, I'd be reading it myself. We're all learning and we're all doing the best we can given the circumstances that we're in, you
Yeah,
know.
exactly. No, no, I totally agree with you because
Mm,
when, I mean, like the some of our psychiatric students or mental health students, they come to me, and when I chat with them, and their opinion is as if they are going to offer the solution to people life. The
yeah,
solution is not with us.
yeah.
Solution is
It's
the
not,
service yourself.
no,
Yeah,
yeah,
you
yeah,
are right.
yeah,
You are right.
yeah,
I totally
yeah.
agree.
Yeah.
So this is how
And
we need
and
to. Yeah, please.
and I think it's important, you know, not to be so worried about having an answer. It's like what you say, saying I don't know can
Yeah,
be actually very empowering because if you don't know and I don't know, well, then it's all right to be, I suppose, you've hit on a very good point, actually, okay, that sometimes therapy is about being comfortable, being uncomfortable.
yeah, yeah,
Instead of saying, I'm uncomfortable, make me comfortable.
yeah,
I'm coming to therapy to feel more comfortable. Sometimes your best therapy or your best one-to-ones is when you're able to sit with somebody's discomfort and
yeah.
allow them be that way in front
Yeah.
of you.
No, when
Yeah.
you mention about this comfortable, being comfortable with the therapist or in a therapy session,
Mm,
because so I have seen some people they long for the day when you give a next date. Okay, next date is in 2 weeks after
mm,
you can come back. So they just target that to. I mean, okay, when is then my next session? They look for it. They long for it,
mm,
and
mm.
because they try to be dependent on the
Mm.
sessions or therapy.
Yeah.
So,
Yeah.
how do you minimize the risk of being dependent on the
Well,
therapy?
yeah, I think that one of the first things I do when
Yeah.
I start working with somebody is to talk to them about CBT and what it is, and more importantly, what it's not. And
Okay.
I would say to them, these are whatever 10 to 20 sessions we'll be doing. In that state, you are ready, you'll be complete, you'll have completed a piece of work.
Okay.
And the last thing, a good therapist doesn't foster dependence. A
Yeah.
good therapist will say, we've done this piece of work. It's time to go. You need to live your life and
Yeah.
get on with living.
Okay.
So it's very important that you make that very clear,
Yeah.
Mm.
Exactly, Gerald. Now you have come to the core point. You mentioned about CBT. What is
Mm.
CBT all about? Why do we say, I know psychotherapy, we talk about different therapies. And I mean, I have heard many therapies when I was doing my studies. But recent times, I mean, like after 2000, I think CBT, people start talking about CBT. So what is this CBT all about, Geraldine?
I suppose, well, in CBT, we work on present
Okay.
problems. That's the first thing. I suppose a lot of therapists would sit down and they'd ask you all about your childhood and whatever. We tend to stick with what's happening the right here and right now. Now,
Okay.
that's not to say we never talk about what happened in childhood, but that can happen if the therapy is not progressing or you feel there's something relevant.
Yeah.
Um, and CBT focuses on your thoughts, your feelings, your behavior, and your physical well-being. So those four areas we talk about and how they interact with one another. And that's really the core aspect of CBT. Um,
Okay.
and it's a huge component of CBT is actually very much education.
Okay.
So, for example, somebody with anxiety,
Okay.
yes, you can talk about the symptoms of anxiety,
Mhm.
but I would also spend a huge amount of time just explaining how those physical feelings of anxiety, how they work within the body, say the fight flight response,
Okay.
and the reason why perhaps you would use conscious breathing, breathing techniques as a way of counteracting anxiety. Because if you're trying to calm your nervous system, you have to understand that I'm just not telling you to breathe. Because somebody who's highly anxious, and you just say to them, "Oh, just take a few deep breaths," that
Yeah.
almost sounds dismissive. What do you mean, take a few deep breaths? Can't you see I'm distressed? But if you understand that the fight flight response is kicked off in your body and how adrenaline works and how all the different parts of your body kick in, well, then the deep breathing makes sense and there's a rationale for it.
Yeah.
So CBT is very much educative. It's very much looking at all those four areas and keeping an eye nearly on everything. Do you
Yes.
know? Yeah,
So,
yeah.
so what I understand is there is no immediate remedy when like people should not come and sit with you thinking that you will give them or give him or her immediate remedy, but you ask
Yeah,
them to
yeah.
exercise that one. Yeah.
Yeah, and certainly as part of CBT, they talk about homework, that you're given a practical thing to do during the week. It's
Okay.
not just you talking to me and talking and talking, and then you go out the door and you feel great because you've had this conversation, but you'll actually be asked to do something.
Mm.
And that could be maybe keep a journal, it could be actually physically doing something, or it could be even reflecting on something that came up in the
Okay.
in the therapy session, do you know? Yeah.
And what is the complaint rate with that? Like people, are they really working on it? Or do you, I mean, like after first one or two sessions, they may not be doing, then it takes after few sessions, they will understand
Mhm.
that they need to do this
Mhm.
kind of thing. So what is your
Mhm.
experience with these kind of things? How many people
Well,
do?
yeah, I think that people take a little bit of time to get used to it and to
Okay.
buy into it. But usually I say to people, you know what? If you haven't done something, maybe that's my fault. Maybe it was too difficult. Maybe you're not ready to do it. Let's see if we can work on something that would be useful to you that you feel you're ready to do. So it's not just me giving out homework or a task, that we both have to agree on it and we both have to explore the advantages and disadvantages of doing it and not doing it and what challenges might come up in trying to get it done. Do you
Okay.
know? And try to address those as best you can.
Okay. So again, I just want to go back, Geraldine. So my curious question as being a normal human being, um, what should I do to prevent I mean, to prevent being into the illness? What should I do? Like to be mentally healthy? What should I do? My lifestyle. What should I do?
Well, I suppose it's the basic fundamentals, that you're eating well, that you're sleeping well, that you're meeting your friends and family, that you have hobbies, that you have interests, but you also have challenges, that you things that you find difficult, but that you're facing, that you're looking to and overcoming. So it's basically looking after very basic things that people think aren't that important. But for
Okay.
example, like I said before, if you're not sleeping, that will have a massive impact on your physical well-being and your mental health. So sometimes you have to remind people to get back to the basics. Um,
Yeah. No, I also feel like there are few factors, other factors. I don't know whether you agree with me or not. I reduced my intake of coffee. I know I used to drink a lot of coffee, but what
mm,
happened when I drank coffee? I used to miss sleep. I mean, insomnia,
yeah,
like kind of thing.
yeah, yeah, yeah,
So then that had a lot of domino effect. It
yeah,
affected my productivity and a lot of things. So what you said is right. Sleep is important, but
yeah,
sometimes sleep itself an indicator of mental problems like mental
yeah,
illness or something.
yeah,
Yeah.
yeah, yeah. Yeah.
So yeah.
Because conversely, too much sleeping is going to be problematic as well.
Okay.
You know,
Okay.
so if I'm getting up later, or if I'm going to bed early and I'm sleep, well, like what is that about? Because I'd have to look at what's happening there that I'm sleeping so much. Am I avoiding something? Is there physically something wrong with me? So
Yeah.
you have to keep a very open mind, as to what's
Exactly.
going on. Do you know? Yeah.
Okay. So no, yeah, it's interesting to talk. I mean, I think if I start talking about mental health, I mean, if we start talking about mental health, we'll be talking more and more. And okay, coming back to this one, so you mentioned we were talking about the things. I mean, like how you will be doing the sessions with them, and you mentioned about CBT. CBT is all about feelings. What is that? See, feelings, behavior, and emotions. Is that right?
Thoughts,
Yeah.
behavior, feelings, and physical well-being.
Yeah,
Yeah.
exactly. And you mentioned you would ask the person to do the homework, and
Yeah.
they will engage you, and they will engage with you and everything. And uh, again, they might. I mean, like I know you always correct me. No, everything will be all right. You will be okay. That is not the right word to say, but you are asking them
Mhm.
to. Yeah, you would ask them to mindful, being mindful, and you
Mhm.
all, I mean, you also involved in some mindful exercises also. What is that mindful exercises, Geraldine?
I suppose,
Mindfulness.
yeah, particularly in the area of anxiety.
Yeah,
Uh, people often have racing thoughts. There's an awful lot going on in their heads, and they're usually thinking of fearful situations or anticipating the worst thing that can happen. And I
exactly.
suppose what you're trying to do as a mental health professional is to take them out of their head a little bit and get them to focus on the here and now. So it could be what we call grounding exercises, where you're sitting and you're saying, what color are the walls? Can you
Mhm.
squeeze your hand? What color am I wearing? You're trying to get them involved in the here and now, what's happening around them. And the breathing technique also helps that. So that is kind of a really good example of mindfulness. We talk about mindfulness being present, totally present to the here and now. It's impossible to be present if I'm preoccupied by something. If I'm sitting in front of somebody and trying to do a one-to-one and I'm thinking about what I'm going to make for my breakfast or my dinner that evening, then I essentially have got distracted. And an anxious person would be distracted by their thinking or their multiple thoughts.
Okay. No, no, yeah, I understand. I can see whatever you are saying, I can easily relate. I think it's not only me, whenever, I mean, whoever is
Yeah,
listening to this, they can easily connect with that.
yeah,
So,
yeah.
do you think anybody is free from this anxiety? I assume everybody is undergoing some kind of mental problems at
I
times.
need to stop for 1 second, okay? I'm
Okay.
sorry.
Okay.
There's
Okay.
somebody at a door. Yeah.
Okay. So, I mean, how do I say if anybody is free from mental problems, Gerald? And you were mentioning that no, I think everyone has their
Mm,
own difficulties and
yeah.
everything.
Yeah.
So, we can only exercise our like same like physical body exercise. We can do mental exercise to keep ourselves
Yeah.
because people who has a higher, I mean, some people are working in a high stress environment and but
Yeah.
still they can withstand with their problems,
Yeah.
but
Yeah.
some people who has less problem but they're not able
Mhm.
to cope up.
Yeah. Yeah.
So why that way? I mean, is that the theory of nature and nurture, or how, why do people, some people suffer and why do some people
Yeah.
cope with it?
I think that again, if we're stuck in that why question, it's impossible. Um, you know, but I think that if you look at, some people can survive in high stressful situations. But
Mhm.
again, it can be their beliefs about that. Again, it can be, their childhood experiences where their parents really set high standards for them, but it was okay to fail. And it was wonderful if you failed, what did you learn? And then if you did well, that was okay too. But somebody else could have a very different learning childhood whereby your parents might say, don't aspire to be successful. You're better off being mediocre and stay safe and don't try too hard. And sure, what do you want to be the best? Or another one would be, why can't you do your best all the time? And you've got 78%, why didn't you get 89%? So the person is afraid, they're capable of doing it, but they're very afraid, well, if I don't get the 90 or the 99%, it doesn't count. So even though on paper they look very successful, in their own heads they have beliefs about it that they've never articulated, never spoken about, and don't really know where they came from,
Yeah. No,
but
you
they're there.
well said, Geraldine, because it is really, really highly relatable. Because in India, month of April and May, the number of suicidal rates
Yeah,
rate goes up. The reason is exactly the same reason. The school results, leaving set or the final year school results come out at that time. So, and usually, as you mentioned, people who would really score well, if they get less mark
yeah.
unexpectedly, maybe if they always score above 90, and if they
Mhm.
get a 80 something, and they would commit suicide. They don't
Yeah,
want to it, and because the
yeah,
expectation,
yeah.
right. So I can easily understand.
Mhm.
Geraldine, we'll come back after a few minutes of break, then we'll
Okay.
continue talking about a few things. Thank you. Thank you.